Hi guys, good morning. This is pre-service. We are doing pre-service virtually. It's a little weird for me, as I'm sure it is for all of you, but we're gonna make the best of it. So here we go. Um, I don't have a lot to talk about. I just have a couple key points that I want to share with people, and then we're gonna talk about COVID stuff, because I know that's on everybody's minds right now. But yeah, let's just jump in and do this. So just wanted to let you know the individual toothbrushes will be coming to your classrooms with a little toothpaste. I'm going to send those home with the kiddos probably early next week. As you know, toothbrushing is suspended in the classroom, so I want to make sure the kiddos are at least doing that at home when they're not in school. Screenings, we are going to complete those outside of the classrooms, like next to the door as well as we can. We're going to try to eliminate, walking the children up and down the hallways like we've done in the past. We're also going to try to do this within the first 45 days. Office of Head Start has said that we won't get penalized if we don't get these screenings accomplished, but we're going to try to do things business as usual as much as we can. I want to talk to you a little bit about Triple Quick and Oxiver. So about May, June-ish, Oxiver was out of stock. So we had to quickly change over to a product that was available. That product is called Triple Quick. It's very, very similar to Oxiver. It is our disinfectant. So I'm going to show you real quick if I can get this figured out. Bear with me. There it is. Okay, so teaching staff, you should have all seen this form. It's the cleaning, sanitizing, disinfecting form. Basically, we're going to use Sanidate for all surfaces that we need to sanitize. So toys, food, food contact surfaces like tables, chairs, and all toys we're going to use Sanidate for. And please remember that contact time is 1 minute. So what that means is you need to spray the Sanidate on whatever you're sanitizing. You need to let it sit for 1 minute to do its thing. You can either wipe it off with a towel or you can let it air dry. Now, Oxiver and Triple Quick, those two are our disinfectants that we're using in our program. So this is the stuff that's going to kill the nasties, the blood, butts, and guts, the vomit, the blood, the butts, and the guts, basically. If you're using Oxiver, please look at the label and make sure you know what product you're using. But if you're using Oxiver, you're going to want to let that stand for 1 minute to do its thing. You can wipe that off if you want to, or you can let that air dry. If you're using the new Triple Quick disinfectant, you need to let that stand for 3 minutes. So 3 minutes, you got to let that stand before you can wipe that up. Any questions on that, please let me know. I've heard through the Vine that people were confused and didn't even know that we had two different type of cleaning agents. So that hurts my heart because we've had these for a couple years. So if you have questions, please let me know. We need to make sure that we are cleaning, sanitizing, and disinfecting appropriately, especially now. I will tell you, Sanidate has been approved by the EPA to kill the Rona, to kill the coronavirus. So that's a positive thing. However, you need to be using the Oxiver or the Triple Quick on like doorknobs, toilets, sinks, that sort of thing, because just because the Sanidate will kill the corona, it's not going to kill the blood, butts, and guts. So the E. coli, the stuff that makes us sick, Sanidate will not kill that. So you need to use your disinfectant for that. And again, please, any questions, let me know. Let me see if I can. Okay, looks like we're back. Gloves, supplies are limited. So I've had to order from different vendors. So you may notice that the color of your gloves are different. The texture is different. That's because they're coming from different people, different warehouses. So they all work. They're they are good medical gloves, but they are going to look different. They might feel different. So just know when things go back to normal, whatever normal is, I'll try to get what we've used in the past. But right now we're just kind of piecemealing, trying to make sure that everybody has what they need. And quantities have been limited. So that's why you're seeing different things. Temperatures and health checks. Let's go here. Bus monitors. You will now see on your bus roster sheets, there's going to be a temperature column. This is where you're going to have to screen those kiddos with a thermometer and document the temperature. Yes, you have to do this, I know. When parents sign their kiddos in the morning, teachers, you will also see a new column on your sign-in sheets for the kiddos that's highlighted in orange here. This is where you're going to document the kiddos' temperature here. And yes, we have to do this. If you have questions about that, let me know. Just a reminder, water fountains are closed off due to Corona. So if you have water fountains in your site, please tape those off with blue tape or find some sort of way to make sure that kiddos and staff don't use those. I will be delivering Dixie cups for kiddos to use once they get out, finish from the playground. So they can come back into your classroom and you can fill those Dixie cups up and, they can drink out of those instead of using the water fountain. If and when we can use water fountains again, I'll let you know. Just a reminder, support meeting guidelines have been updated just a little bit. We're not going to have the normal meeting where we have 10 people around a conference table room meeting. We're going to do a lot of these by Zoom, by phone, whatever. But just a reminder, just because we're not sitting around a table, those forms still have to be completed. So whoever's running the meeting, make sure you have the support meeting form completed. Make sure the no-goes are done, the red alerts, the med permission forms, and the diet mod forms. All of that still needs to be completed just because we're not having our formal meetings like we used to. Here we go. Oh, on the website, all of the health, nutrition, and disability forms have been updated. So if you just go on the Community Action website under health, mental health, disability, and nutrition, you'll see the updated forms for 2020. And just a reminder, sunscreen starts September 1st. So that log will need to begin on Tuesday. Lorna Hood. Emergency preparedness plans. I want to show you. I'm almost done with these, but this is what, I don't know if you can see this, but this is what they will look like. Basically, it's a DHS requirement that we have to have those EPP forms in all of your classrooms. It is a very, very detailed form, basically, that says what this classroom is going to do in case there's a fire, a tornado, a bomb threat, whatever. Since it's a DHS requirement, it has to be up on your emergency board, but I would prefer that you use your the flip charts that are by your door. I think those are easier for you to thumb through if there was a true emergency. I mean, these forms are great, but it's 19 pages long. So if you are in a hurry and need to know where you're supposed to go for whatever emergency, it's easier to flip through the flip chart than it is to thumb through this 19-page book. Everybody should have those by now, except for a course. Those will be out hopefully Friday to you. So if you have questions about that, let me know. We need to talk about pods. So with COVID and little kids in a childcare setting, we need to think and be mindful about who is in our pod. So let's say I am in a classroom with 10 kiddos. I want to try to contain those 10 kiddos and my staff in a pod. That way, if I get sick, we can just exclude this pod. Whereas if I'm here and then I go over to this pod and then to this pod to talk to somebody or whatever, and then I end up coming down with Corona, these two pods are now exposed from my sickness. Whereas if I stay in this pod, with my 10 people, we're just affecting these 10, if that makes any sense. Basically, we're going to try to reduce the amount of people that we come into contact with. That way, if somebody is sick, we can just exclude those few instead of the masses, if that makes sense. Let's talk about Child Plus real quick. Teachers, this is really for you. FGS, we had a meeting and I think everybody is good with the new updates, but I just wanted to share a couple things. So in the health tab, if you are if you're sending a kiddo home because they're sick, or if you've talked to mom about shots, or you've talked to mom about a physical, or hey mom, Joey failed his screening, his vision screening, this is where you're going to document all that stuff. So previously we would have put it in the family services tab. That's no longer a thing. And honestly, I think it's inactivated for everybody but FDS. So if you're ever doing anything or need to record anything about a kiddo's health, you're going to do it under the health tab. So click on the health tab, and then you're going to see a section called health contacts. That's where it's going to go. I'm going to walk you through this real quick just to make sure. Yep. Okay, here we go. So I'm clicking on health contacts. I'm going to click on the date, and you can see it's 8/27. I am going to click face-to-face because I just talked to mom in the hallway. And the contact reason here, we're going to talk about physical. So I'm going to click physical reminder. I'm just making this up as we go here. Okay, I'm Jennifer, and I talked to mom at drop-off to let her know that Joey's physical expires October 4th. I'm going to save that, and that's going to go in his health contact. So basically, long story short, any type of contact that you have with a parent or a family member about a kiddo's health status, whether it be an illness, a screening result, a support meeting, a food allergy, med permission form, whatever, all of that information is going to go in the health services tab instead of the family services. Again, questions, let me know. Okay. Let's talk about COVID. So I hope everyone has read the procedures that, I don't know if you can see that, the procedures that have went home and your welcome back letter. Honestly, when people call, I have to refer back to it all the time. It's a lot, I know, but please know that that information came from an array of sources. It wasn't just me sitting behind my desk thinking, oh, what can I do to make staff miserable? That wasn't it at all. That information came from our health department, from Office of Head Start, from DHS, IDPH, and Burlington, and FMPEDS. So know that there's a lot of professional people out there that made these procedures for us to follow as a way to keep us safe. So let's talk, just a brief reminder, if there is a positive test, so I tested positive, you need to let me know who tested positive, because I have to report to DHS, I have to report to CCR&R, and I have to report to our health department. Those three people will determine what happens. If we close a classroom, if we need to close a center, if we need to close an office. I have no pull in what happens. It's up to those three entities. But I need to know as soon as possible if you know a kid that tested positive or a staff member that tested positive, because we have to keep everybody safe and we need to do it in a timely manner. So as soon as you hear or know of a positive test from anybody, let me know. A reminder, we need to reduce the number of adults coming in and out of the classrooms. You know, I talked about the pod thing earlier. So this is true. So for like FDS, cooks, community partners, anybody that doesn't need to be there, like really need to be in the room, they shouldn't be. We need to keep those kiddos and those regular teachers contained in those pods, so we can reduce the spread of any illness. Another reminder, don't congregate in hallways, don't congregate in cubicles, break rooms, that sort of thing. Wear your masks. I know it sucks, but we got to do it. Here's an important thing, children with asthma, if they require a nebulizer treatment, they can't attend school right now. If they can do their treatment with an inhaler with like a spacer, that's acceptable, but not the nebulizer, not the thing that goes over their nose. Reason behind that nebulizer treatment creates an aerosol or droplet contamination in the air. So if the kiddo that's getting the treatment does have COVID, they're just spreading it in the air to everybody. And that's no go. Couple things. If you are symptomatic and you've been exposed, meaning you've had close contact with somebody for more than 15 minutes and you've been within 6 feet of that person, you are out for 14 days and you need to go get tested. if you were at a barbecue and you got a phone call that your sister or your cousin or whatever that was at that barbecue tested positive, you need to call your healthcare provider and you need to say, I was at a barbecue with somebody who had COVID. What do I do? They will determine if you need testing. Regardless of either situation, I need a note saying what's going on and what your provider is planning to do. I need a note saying your test was negative if it was negative, and I need a note if it was positive. I have to document all of that stuff and keep all of those records. So the more I have, the better. Again, if you have questions, I know this is confusing, but if you have questions, call me. Refer back to this checklist. I do it all the time. Go through the scenario 1, 2, 3, and yeah, if you have questions, let me know. Let's talk about, I did get a couple questions about COVID stuff and classroom stuff. So here, we're just going to talk about that real quick. One of the questions was, why are we having the parents sign their child in and out every day? Basically, it's a CACFP regulation. We have to. They're saying a parent or guardian must physically sign in their child in and out every day. If they do sign in and out, which they have to, one of the teachers is asking, we're going to have to touch those folders because we have to record the temps, on that sign in and sign out sheet that I showed you earlier. Yep, that's true. My suggestion is to either glove up every time if you want to, take the kiddo's temp first, and then if it's less than 100.4, then have that parent sign in and out. Honestly, use hand sanitizer, wash your hands, wear gloves if you want to. It's no different than touching a doorknob or going to Walmart or going to the library or going to the ATM, whatever. I mean, use hand sanitizer, wash your hands. There's no getting out of having the parent sign in and sign out their child. I tried, I'm sorry. If a staff member's child gets exposed to COVID, and they can't go to backup daycare and they don't have anybody else to come get their child, what do you do? Well, number one, have a backup provider. You have to. Worst case scenario, though, another teacher could fill in for you. This is worst case scenario. I remember we talked about the pods and keeping the same amount of kids with the same teachers. Yes, I want that to happen, but worst case scenario, another teacher would come in and fill in for you. We want to try to eliminate that as much as possible, but we have to do what we have to do to keep our classrooms and centers open. Another question, who determines what cough, runny nose stays or goes? So honestly, this is business as usual. The teacher will determine if a child can stay or go. If the illness prevents the kiddo from participating comfortably in class, send them. If the illness causes you, more time because you're taking care of that kiddo versus spending your time with the other 16 in the class, they got to go. Teachers, I trust you. I'm never going to come down on you. Why did you send that kiddo home? I know you all. I trust you all. The only thing I ask of you is that if you send a kiddo home for an illness and there's a parent that's upset, please give me a heads up. I hate getting phone calls from parents, and I have no idea why they're calling me, who they are, who their kid is. So just shoot me an email, call me, let me know. Hey, I sent so and so home for a pink eye or a snotty nose or whatever. Just so I have an idea of what's going on. Amy from the health department did tell me to share that if a kiddo has had, like if a child has a snotty nose, and if a kiddo hasn't been exposed to COVID that the parents have reported, then don't send them home. They don't need to be sent home for a snotty nose, unless it's the thick green snot that's disgusting that you're taking time all day long wiping. They can't take a nap, they can't eat, they're miserable. Send that kid. But the normal snotty nose kid that we all see, they can stay. Last question I got was, can the kids bring backpacks to school? Yep. So the health department has deemed backpacks safe for our kiddos, but just a reminder, if you have cubbies or if they have lockers, please put all that stuff in there. That's going to reduce the spread of bed bugs and fleas and lice and all that fun stuff. So guys, that's all I have for you this morning. Again, if you have questions about anything, please don't hesitate. Call me, email me, whatever. I look forward to seeing all of you here soon. I miss you. Stay positive, stay healthy, and we will get through this together. All right, guys, have a good day.